Assalamu alaikum everyone, this is Hamza Hussain and a very warm welcome to Pakistan Cardiac Super League Season 2 presented to you by Pakistan Cardiac Society and powered by Wilson's Pharmaceutical. Today we are live for the 14th match which is between JINNAH Eagles and versus S.I.C.V.D Thunders. Before diving into excitement of the match, allow me to introduce the expert faculty members who have graced us today with their presence. We have with us match umpire Professor Abdul Hamid Siddiqui Saab. Professor Abdul Hamid Siddiqui is former professor of cardiology at AFIC Rawalpindi. And from the governing council members, we have with us the General Secretary of Pakistan Cardiac Society, Professor Fawad Farooq Saab. Professor Fawad Farooq Saab is working as a professor of cardiology at S.I.C.V.D Karachi. Along with him is mentor of S.I.C.V.D Thunders, Dr. Iftikhar Ahmed Saab. He also joined us today. And we have also with us the chairman of Pakistan Cardiac Super League Season 2, Professor Feroz Mehman Saab. Professor Feroz is Professor of Cardiology and Vice Chancellor at University of Modern Sciences at Tandon Muhammad Khan. And last but not the least, allow me to introduce the moderator of today's program, Dr. Hamza Ghori Saab. Dr. Hamza Ghori Saab is working as an assistant professor of cardiology at RIC Rawalpindi. And I will now hand over the mic towards Dr. Hamza Saab to please start the formal proceeding of this match.
Thank you very much, Hamza. It's again great to be back to this second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and, of course, Wilson's Pharmaceutical. So the league matches are on, and today's game is also another of those crucial initial games in the leagues. So we have S.I.C.V.D Thunders versus JINNAH Eagles. And it's a sunny day after a lot of rain, so I do expect some up and down bounce in the wicket, but I'm expecting a good score. We are all expecting a fight today. So with this, I'd like to take the opportunity to welcome our esteemed panel members. We have Professor Feroz Mehman with us, and we also have Professor Fawad Farooq, always the key to this tournament and the competitions like the rest of the faculty members. We also have Dr. Iqtidaruddin with us. I've just been told, so welcome, sir. Welcome to this league game today. And last but definitely not the least, the umpires who make it possible. And today, for today's game, it's Professor Abdul Hamid Siddiqui who's going to be the umpire, an extremely important umpire for the game. So with this, I now move to the two teams, and I would request the two captains to start with the introductions. So first we have S.I.C.V.D Thunders. The captain to please introduce the teams.
Assalamu alaikum. I'm captain of the team. My name is Dr. Rabi Harouch, and on the right hand, she's Dr. Kinza, and she's Dr. Ilham, and on the left side, she's Dr. Kanchan.
Welcome to the game and best of luck to you. Now I move to JINNAH Eagles, and the captain to please give us the introduction.
Hello everyone, I am Dr. Nimra Javed, fourth year resident of Lama Iqbal Medical College in Hospital Lahore of Cardiology.
All right.
Rest of the participants are awaited. Hopefully they will be here in next 5 minutes.
At present, she is all alone to face the thunder.
Okay, very true, very rightly said. I think she's also waiting for her captain. Hopefully they'll be joining her soon. Well, best of luck to you, and I know you could be a force to reckon with. Hopefully you will do the job, and hopefully you'll be joined by your team members. So with this, without waiting or wasting any more time.
Excuse me?
Sir, Dr. Yes, Professor Feroz.
Sir, मैं ये कह रहा था कि मतलब how fair it is that एक टीम का सिर्फ एक ही मेंबर आया है और दूसरे नहीं आए हैं. तो I think we should have a policy for this कि अगर पूरी टीम नहीं आती है, which is the duty bound to be in this time, और ये time bound program होता है. If they were on duty, they have arranged alternate. Basically, I think this match will be unfair. It will be not right thing to do.
Very right, sir. I think we have the senior council members and the umpire also. So it's for everyone to decide. Sir, inputs please.
I think let's input from Dr. Abdul Hamid Siddiqui, and then finally I'll say something also about it.
Right, sir. Sir,
Dr. Abdul Hamid.
Sir, are you there?
Hamza was saying that we can wait for 15 minutes. So I think the 15 minutes have already passed. So we can further wait for another 5 minutes, and if they do not turn up, then we can, I think, stop the match here. And this is what
And
I
I think
think.
you want the walkover to be given to the other team for showing up in time.
Yes, definitely. I
I
think
think so. We should give the walkover.
Yes, yes, sir.
they deserve walkover
One
because
thing, a middle way to that is if we can do a toss, and if luckily Jinnah Eagles wins the toss and
they
give
start answering.
batting,
Yes.
yeah, they are not answering. Answering part will be that S.I.C.V.D. Then we'll wait till that inning, till questions. If they haven't have anyone there, then we'll give walkover.
I
I
think that's a
think
very fair
I
suggestion
will
and
agree
neutral
to that.
one. But I suppose we should make
But
a
if
rule.
SICVD wants the toss and they have to answer the question, then we'll wait just 5 minutes for that.
I think that is fair enough.
Sir, I will give a suggestion that I think we should frame rules now. That in such cases when the team doesn't
Yeah,
come, we
inshallah,
should
sir.
give
Next time we'll
whatever because yeah, I
inshallah
think for
next time
next
we'll
time we should frame
formulate
the rules.
something for that because
Say,
it's for the first time
sure.
it happened. Hamza,
Right,
just do
right.
the
That's
toss.
why. Yeah.
Yeah, just
Okay.
go for the
Okay.
toss and
Right,
let's
sir.
see. Its toss is very important for Jinnah Eagles. They will got 30
Yes.
minutes buffer if they won the toss.
Right, sir. So it's been
Jinnah Eagle
decided
Buckup.
by the worthy umpires and the council members. Maybe Dr. Feroz, you were saying something. I'm sorry, I interrupted you.
Yeah, I said yes. This is okay. I think I agree with Fawad. This is the first time, so we'll be a little lenient. But we should frame a rule that the
Yes,
team
sir.
doesn't come for 15 minutes. The game should be over.
Agree,
Very
sir.
right, sir.
Agree.
Very right. We all agree on this. So as
Okay.
per
The team has arrived. The team has
That's
arrived.
what I was hoping. Okay, Hamza, go ahead.
So now moving for the all important toss. Right, on your screen we have the electronic coin toss, and I'm going to randomly ask S.I.C.V.D. Thunders to choose heads or tails.
Heads.
So it's a heads. All right. Women power, let's see. And it's heads. So
But now-
Thunders have won the toss. All
Now
right.
Thunders have to face the music because the opponents are complete.
Right, sir. So in any case, I think we're going to have a match now. So my first question to the Thunders. Do you want to take the questions or you want to throw the questions?
We want to throw the question.
All right. They want to throw the questions. And with the second question, do you want case A or case B? Which one?
A.
Case A. So they want to throw, and they want to throw case A. Right. So let the games begin. Let's have the match. And we have the scenario A on your screen. Read it, please.
68-year-old man presents to the cardiology clinic with complaint of progressive dyspnea on exertion, fatigue, and occasional episodes
Excuse
of
me, it's
agitation.
invisible. Excuse me.
All right.
Scenario is not clear. It's blood. and
Okay, hold on, please. I'll
It's
request the
okay.
technical team to resolve the
Plain
issue.
blood.
Okay, can you see it now?
I think last time we have decided that one of
It's
the Jinnah Eagle can have a link, Zoom link of that expert part as well, so that they can see it on mobile as well. So if
Yes,
it's
so-
possible right now, can we do that so that we don't have this hindrance?
Yes,
of
sir. The
this
technical team is on it. They are on it. They are doing it right now.
Or one of their one of the member of Wilson should give their mobile to the Jinnah Eagle so that
Yes.
they can see it on mobile.
I'm sure, sir. They are on it. So
Okay.
the technical team will let us know. So they are logging in at the moment. I think it's only going to take a couple of seconds, hopefully.
Okay.
Assalamu alaikum. I'm Anis Mufti. I'm in Lahore right now, but I'm also facing the internet issues. I think there is some issues in internet in whole Lahore since morning. I'm here, and I'm facing difficulties as well in different location of Lahore.
Yes, agree, Anis. We do have a lot of difficulties right from the morning. Even in Karachi, we have a lot of hiccups with internet connectivities. I don't know what its overall problem.
Yes, there seems to be a problem, I think, in most of the cities.
There is an
That's what
issues
I've been
with
told.
connectivities.
Very right. Even in Islamabad, we were having some issues. So it's nationwide, I believe.
So, Anif, can it be possible to have that mobile connection to the Jinnah Thandar so that they can see it on their mobile?
So I think they're just asking for a minute, and we'll
Uh,
have it.
the link has been shared. Can be easily connected by any member of the
Jinnah
team
Eagle.
player in Jinnah. The link has been shared in group. They can join us from that link easily.
Okay.
It's possible for them.
Jinnah Eagle, if you have the link, just connect with that link of the expert panel link where you can see these questions on your mobile.
I'm sure they have the team on ground, so I hope they are
We are
making
trying
it.
to connect, so wait a bit.
Okay. You
Dr.
take your
Nimra, I have
time.
sent you the screenshot of the scenario. Dr. Nimra, I have just sent you the screenshot of the scenario.
Yes, I'm trying to download because the internet connection here is not in good position right now. Give me more 1 minute. It's not
Okay.
downloading.
Shabazz, can you help? Can you help Dr. Nimra? I've also sent you the.
ओपन हो रहा है आप बोल दें क्योंकि इंटरनेट इस कमरे में इंटरनेट नहीं आता मसला ये है ना
Everyone from Jinnah can easily join. Everyone, I advise everyone can join it. So they will see the question on their mobile as well.
So is anyone able to join in from Jinnah so far? Jinnah Eagles, can you hear me?
Yes.
So have you been able to join? No luck?
Jinnah Eagle, have you pinned the Cardiac Super League window already? Because if you haven't pinned the Cardiac Super League window, you can't see the scenario on full screen.
So Jinnah Eagles, have you pinned it? We would be needing a response from Jinnah Hospital. So Jinnah Eagles, can you hear us?
Excuse me.
Yes.
आपने जो स्क्रीनशॉट भेजा है वो फायरवॉल की वजह से वो डाउनलोड ही नहीं हो रहा तो फायरवॉल की वजह से व्हाट्सएप पे डाउनलोड नहीं हो रहा
Jinnah
I
Eagle,
also
kindly
has
Jinnah
I
Eagle,
also have
kindly
joined from mobile. I also have joined from mobile. So I don't think so कि firewall की वजह से थोड़ा सा link slow हो रहा है, but it's
फायरवॉल
been
की वजह
working.
से नहीं हो रहा फायरवॉल की वजह से
Request the technical team on ground to look into it, please.
वाईफाई जब तक ये दरवाजा नहीं खुलेगा वो जितने
We're running out of time now.
Anybody from Wilson who can support them?
हाँ बुश पार्टी वाला है वो तो मैंने कब किया मैंने डॉक्टर इस्लाम वाला भी
Jinnah Eagle, क्या आप इस चीज को वेरीफाई कर सकते हैं कि सिनेरियो आपको फुल स्क्रीन पे नजर आ रहे हैं अपने?
चल रही है वो नहीं होगा
क्या आप ये एक्नॉलेज कर दें प्लीज?
Jinnah Eagles, just answer this question, please. Can you see the whole scenario on the screen? क्या आप इसको देख सकते हैं अपनी स्क्रीन पे?
फुल स्क्रीन पे, और इन्होंने क्या कार्डिक सुपर लीग को पिन किया हुआ है?
जिन्ना ईगल्स, क्या आप हमें सुन सकते हैं?
Yes.
ये वो
Okay, so do you have the scenario? Jinnah Eagles, order in place, please. Jinnah Eagles.
Yes. Yes.
Jinnah Eagles.
We have this scenario now.
Okay, so I would request everyone to please be attentive now and let's focus on the game. Do I have everyone there?
Yes.
Yes.
Okay, so can you please read the scenario?
68-year-old male presents to the cardiology clinic with complaint of progressive dyspnea on exertion, fatigue, and occasional episodes of palpitation over the past 3 months. He also reports swelling in his lower extremities that worsen by the end of the day. The patient has a history of hypertension and type 2 diabetes, both of which are well controlled with medication. He denies any history of coronary artery disease or prior myocardial infarction. Physical examination, blood pressure 145 by 85, heart rate is 90, respiratory rate is 18 breaths per minute, GVP distension, cardiac auscultation, regular rhythm with an S4 gallop, no murmurs, lung auscultation, bibasilar crackers, lower extremity 2+ pitting edema. Laboratory test shows BNP 480 picogram per ml elevated, serum creatinine 1.1 milligram per deciliter, HbA1c 6.5%, electrolytes within normal limits. Echocardiogram findings: left ventricular ejection fraction is 60%, left atrial enlargement, diastolic dysfunction with elevated filling pressures, no significant valvular abnormalities.
All right, so with this, Jinnah Eagles have a few seconds to gather themselves and then we will start with the first question. Team to keep their mics open and rather switch the mics on once they are answering the question. While the other team is reading it, they should either not talk or should keep the mics on mute. It's a request to everyone. Thank you. All right, so Jinnah Eagles, are you ready? Jinnah Eagles, are you ready?
Yes, we are ready. We can proceed towards the questions.
Okay, let's have question number 1 on your screen.
Which of the
Read
following
it.
is the most likely diagnosis? Heart failure with reduced ejection fraction, heart failure with preserved ejection fraction, acute coronary syndrome, restrictive cardiomyopathy, constructive pericarditis.
Okay, your 60 seconds start now.
Confirm beta. Beta. Our answer is beta.
heart failure.
Beta answer, heart failure with preserved EF.
Okay, so are you sure you want me to lock it?
Yes, we want to lock option beta.
All right, they want us to lock option B, beta. Lock the option. Well done. You start with a 6. Over the boundary for a 6. Well done. Very well played. And I will request Jinnah Eagles to make sure that the answer is given by the captain only. So the captain is supposed to give the answer. Right. Thank you very much. So that's a good start. Well, moving to question number 2 on your screen.
Which of the following is the most appropriate initial management step for this patient? Alpha is start beta blocker therapy. Bravo is initial diuretic therapy. Charlie, benign intravenous inotropic support. And delta is perform coronary angiography. And epsilon is scheduled for cardiac resynchronization therapy, CRT.
60 seconds on your screen, please.
Lock option beta.
All right. Are you sure you want me to lock option B? You still have time.
Yes.
Okay. So this gives me an opportunity to welcome Professor Suhail Aziz. He's with us. It's great to have you, sir. So, Jinnah Eagles are answering and they have opted for option B, beta. You want me to lock it?
Our answer is beta. Please lock option beta.
All right. Lock beta. Lock it. Oh, yes. Another 6. This one is flicked over square, I think. That's a 6. Second in a row. Very well played. Well done. Now, moving to question number 3. Read, please.
Which echocardiographic finding is the most indicative of diastolic dysfunction in this patient? Alpha is left ventricular ejection fraction of 60%. Bravo is left atrial enlargement. Charlie, elevated feeding pressures. Delta, no significant valvular abnormalities. Epsilon, none of the above.
And your timer starts now.
Option C, elevated filling pressures.
All right, that's very quick. They've come down the wicket. Are you sure? You want me to lock it?
Yes, we want to lock option Charlie.
All right, coming down the wicket, and they want us to lock option C, Charlie. Lock it. Oh, that's a big one. Straight over the ropes. Huge 6. Well done. So that's 3 in a row. Very well played. Putting pressure on S.I.C.V.D. Thunders now. Well, let's see what happens on question number 4.
What lifestyle modification would you recommend to this patient to help manage his condition? Increase salt intake, limit fluid intake 1.5 to 2 liters per day, avoid physical activity, follow a low sodium diet, and maintain a balanced diet and regular physical activity.
60 seconds on your screen. Let's see what happens. Eagles are playing this one carefully. "25 seconds. "15 seconds. Eagles. 10 seconds. Come on, 6 seconds, hurry up. 5, 4.
Lock option eta, E.
Okay, just at the last second, they want us to lock option E, epsilon, right? Okay,
Yes.
lock option E. Oh, that's the first mistake of the day. Well, that swung away from you. Never mind. Very well done. You still have a lot of questions left. So, moving to question number 5 on your screen.
Which class of medication is generally recommended for managing HFpEF and improving symptoms, especially if there is no fluid overload? ACE inhibitors, beta blocker, loop diuretics, SGL2 inhibitors, and calcium channel blockers.
Timer starts now. 60 seconds.
Lock option delta, SGLT2 inhibitors.
खोल दे.
Lock option delta.
Okay, so you want us to lock option delta. D delta, right. So
SGLT2 inhibitors.
SGLT2 inhibitors, delta, lock option D. Oh yes, that's well played. Another 6. Well done, very well done, Eagles. You may be in for a big score. Let's see. Now, moving to the next question, please. Question number 6.
What is the primary goal in the treatment of HFpEF? Improve myocardial contractility, reduce fluid overload and control blood pressures, increase heart rate, aggressively lower blood glucose levels, या prevent thromboembolism.
All right, 60 seconds start now.
Lock option beta, reduce fluid overload and control BP.
Okay, so you want me to lock it?
Yes, we want to lock beta.
They want to lock beta. They really want to play this T20 in T10 style. If Ishaq Saab was here, he would have told you not to do it. All right. So as sure as they are, locking option B beta. Lock it, please. Oh, yes. Very well done. And that's been hooked for a 6. Well played.
I think that's their style, like Afridi or Jaisuriya. Whenever
Oh,
they're
yes.
early, they're always right. When they took time,
Very
they
well
lose.
said, sir. It's Jai Surya's. I would say Jai Surya and Afridi totally agree. That's the way they are playing, and why not? If you're sure, you know the answers, you play like that. So great going. Well done. With this, we have the next question, which is question number 7.
In a patient with HFpEF, which advanced echocardiographic technique is most useful for assessing myocardial strain and detecting subclinical systolic dysfunction? Three-dimensional echocardiography, Bravo is Doppler tissue imaging, Charlie is speckle tracking echocardiography, Delta is contrast echocardiography, and Epsilon trans esophageal echocardiography.
60 seconds start now.
We want to lock option C, Charlie, speckle tracking echo.
My goodness, you really are smashing them down the line. You want me to lock it? C. Are you sure?
Yes.
Okay.
Yes.
Yes, they are sure. So, lock option C, speckle tracking echocardiography. Oh, yes. That's brilliantly played. Very well done. What a stroke. Over the covers for a 6. I think everyone would agree. Well done. So, that's great going, Eagles. You're flying like eagles at the moment. All right. You were slow to show up, but you were pretty fast to score. Anyhow, question number 8 on your screen.
Which of the following biomarkers, apart from BNP, has shown promise in reflecting myocardial
Excuse me, question 8 is not
All right, you can't see the question?
visible?
Technical team.
Now we can see the question.
Oh, okay. Read the question.
Now
please.
it's
All right.
Which of the following biomarkers, apart from BNP, has shown promise in reflecting myocardial fibrosis in HFpEF patients? Alpha is troponin I, Bravo is galactin-3, Charlie D dimers, Delta is C-reactive protein, and Epsilon is lactate dehydrogenase.
And timer is on your screen. Okay, so Jinnah Eagles, I would request the answering team to keep the mic open. We would like to hear the discussion. I think everyone would be interested in that. 20 seconds. Come on, Eagles. 12 seconds. 10.
beta. Lock option beta, galactin-3.
All right. They want us to lock option B. This time they are not sure. Well, we'll see what happens when they are not sure. Locking option B beta. Oh! Even when they are not sure, it's going for a 6. That's a fiery innings. Well played. Very well played. Well done. Dr. Fawad seems to be excited as well. All right.
Everything is supporting Jinnah Eagles.
Yes, I think everything did. So, anyhow, I think you have a chance to equal the highest
that was
total.
a 6 on third man.
Exactly. That was a 6 at third man, very rightly said, sir. So, they have a chance to equal the highest total of the season. They've only dropped one question so far. So, with this, moving to the second last question, question number 9.
What is the role of cardiac MRI with late gadolinium enhancement in the evaluation of HFpEF? Alpha is identifies coronary artery blockage. Bravo is assesses myocardial perfusion. Charlie is quantifies myocardial fibrosis. Delta is detect intracardiac thrombus, and epsilon is measure pulmonary pressures.
60 seconds on your screen.
Lock option Charlie quantifies myocardial fibrosis.
Okay.
Lock option C Charlie.
Again, they've come down the wicket, and I think this time they're eyeing the mid-wicket boundary. Okay, lock option C, Charlie. They want us to lock it. Lock it, please. Oh, yes! Great! Very well done. Very well done. It's a huge six. Very well played. So, yes, you are definitely in with a chance with, scoring the highest or equaling the highest total. So, very well done. And with this, I'm moving to the last question of this innings. Question number 10.
Which of the following is an appropriate management strategy for the controlled blood pressure in HFpEF patients with persistent hypertension? Alpha is beta blockers, Bravo is aldosterone antagonist, C is ARNI, Delta is SGL2 inhibitors, and Epsilon is ivabradine.
Timer starts now. 60 seconds.
पुरानी अमेरिकन गाइडलाइन थायराइड को नंबर 1 रखती थी तो बाकी फर्स्ट लाइन
लेकिन वो ACRB होता है कभी आने ही नहीं डाला
25 seconds. Come on. We are hoping for a tie here.
Lock option C Charlie Arnie.
All right. Are you sure? You want me to lock option C, Charlie?
Yes, lock option C Charlie.
All right. Lock option C, Charlie. Oh, yes. Very well done. Great stuff. Wonderful end. And you end with a big bang with a huge six again. And very well done. Just lost one question. And I think that's a massive total. You've tied it with the highest in this season. That's a wonderful score. And with this, I'm now going to move towards our experts and our umpire to start with. Professor Abdul Meet Siddiqui, sir, your thoughts on the game? 54. That's the target.
Very well played by JINNAH Eagles. The pitch was flat without any grass, so the bowling was predictable. So they played very well. I think they put a very good total, and let's see what S.I.C.V.D Thunder how they behave. Let's see their batting.
Thank you very much, sir. It was a consistent bounce on the wicket, and that definitely helped them. And they're well played. They're very well played, and they've done a good job. It's a big total. And I ask Professor Feroz Mehman, I can see him there. Sir, your thoughts?
Thank you. Thank you so much. I think it's a wonderful, exciting game. And I must congratulate JINNAH Eagles because they came from the backward, from a very awkward position, and then came in and played with a real boom, boom. I wish them all the best. I'm sure. Fawad is also very, at the moment, concerned that his S.I.C.V.D will have to work a lot of effort on the pitch to beat JINNAH. I wish both the teams good luck, but especially congratulate JINNAH Eagles. I think it was a wonderful game.
Thank you very much, sir. And now we have Professor Fawad Farooq. Sir, the score that has been put up by JINNAH and the prospects for S.I.C.V.D Thunders. Your thoughts?
I think today the luck is with JINNAH Eagle because it's S.I.C.V.D which has given them this case one. Apparently, I see a lot of options like very easy in a way up like PSL, Pakistan Cardiac Super League standards. According to those, usually we got a very tricky and very hard questions. Today we see a lot of options which are not matching together, not confusing options. So it's good luck for JINNAH that they got that scenario. Let's see what happened with S.I.C.V. Thunders.
Very well said, sir. I think it's always with all the effort that you put in, luck is always something that you need.
Yeah.
So,
Agree.
yes, I think
Dr.
it's.
Hamza,
Sure, sir? Yes, sir.
I would like to add one thing, rather mention that Jinnah Eagle is the finalist of last season one.
Hey,
All right. Yes. So Anis Mufti Saab is there, and he's saying they are the finalist of the previous season. So it was always expected from them to put up a big show, and maybe they are eyeing this trophy this year. So, and we all know that Jinnah Institute, Jinnah Hospital, they are always known for their meticulous work, their hard work, and the way they train. So again, I think they have showcased all that, and hopefully I think we'll have a wonderful game. With that, I must say that it's all is not lost. S.I.C.V.D Thunders, they seem to be very confident, and I'm sure they're gonna give a good fight, and you never know what happens. It ain't over till it's over.
10 sixes and 10 balls.
You never know, sir. So all the very best to them. And with this,
Yes.
we are now going to start the second innings. So can we have the scenario on the screen? Read it, please.
A 55 years old diabetic hypertensive obese gentleman presented to ER with 10 hours history of chest pain. On examination, he had a heart rate of 120 per minute, blood pressure of 180 by 100, chest auscultation showed vascular pattern of breathing. An ECG was done that shows ST elevation in inferior leads and isoelectric lead V1. He weighed 2 to 5 pounds and has height of 5 feet 8 inches.
All right. So S.I.C.V.D Thunders, you'll have a couple of seconds to gather yourself and let me know when you're ready. Okay. So
Let's start the question.
can we have the first question on the screen and read it, please?
What is the electrocardiographic diagnosis? Inferior wall MI, inferior wall MI with RV infarct, inferior wall MI with possible RV infarct, inferior wall MI with posterior extension, inferior wall MI with posterior extension and RV infarct.
And your 60 seconds start now.
Hamza, we got to take input. We forgot to take input of Dr. Iftihar and Dr. Bilal, the mentor and coach of S.I.C.V.D Thunder. So you can take their input after the match.
Them in and we'll take the comments from them. They're very important for us, for sure.
Okay, Charlie. It's Charlie.
Charlie, are you sure?
Yes, inferior wall MI with possible RV infarct.
Okay, just answering at the last moment. Charlie, see Charlie to be locked. Oh, well done. Yes, that was surely the right answer. Very well done. Very well thought out. But always be mindful of the timer. Right. So, you start with a 6. Brilliant. What a start. Now, question number 2 is on your screen. Read, please.
To aid your diagnosis, what should be the next step? Echocardiogram, HS troponin, CKMB, right-sided ECG, coronarogram.
All right, your 60 seconds start now. I'll request the answering team to wait till they're done with the questions.
Delta, right-sided ECG.
Okay, they've come down the wicket and they want to hit it over long off. Are you sure? Delta, right-sided ECG. Are you sure? Should I lock it? Should I lock Delta?
We have already given the answer. We have, yes, Delta.
Okay, they're very sure. Delta, lock delta D. Oh yes, very well done. You've already given the answer, you're already right, and it's already a 6. Beautiful stroke. Well done, very well done. Okay, that's a good start. Competition at its best. Question number 3 on your screen now. Read it.
वो सामने से हटेंगे. Which lead is more sensitive for RV infarct? V1, V3R, V4R, V5R, V6R.
All right, your 60 seconds start now.
It's Charlie. It's Charlie. V4.
It's
Right side.
Charlie V4R. They've come down the wicket. I think it's a full toss. Is it going for a 6? Well, well, well. Charlie V4R. All right, lock Charlie C. Yes, it definitely was a full toss, and it's been hit. Even when they had thrown the ball, even they were laughing. They knew that it's going to be a 6. Well, well done. Very well played. It's a good competition at the moment. 3 in a row, 3 6s. Can you hit the 4th one for a 6 in a row? Jinnah, well, they are worried. All right. Question number 4 on your screen.
To record V4R, where would you place the electrode? A, 4th intercostal space at the left sternal border, 4th intercostal space at the right sternal border, 5th intercostal space in the right mid-clavicular line, 5th intercostal space at right sternal border. None of the above.
And your timer starts now. So I will request the answering team to keep their mic open. We want to hear the discussion. S.I.C.V.D thunders. Okay, so there is some technical issue with Karachi, I think. The link has frozen or something. Can we hold it? Do we have them? Okay, so we have lost link with them. I think we'll have to hold here. The team is trying to get in touch with them. Okay,
हमारा
so
डिस्कनेक्ट हो चुका था ये.
okay, so
डिस्कनेक्ट हो गया था.
okay, so you're back.
Yes, now we are back.
Okay, you're back, and 30 seconds had elapsed. So yes, start the timer again.
We cannot see the answers. We cannot see the scenario. Blur है. Scenario is
Okay,
blurred.
technical team to look into it. So where do you place? Can we have the question, please, on the screen? Okay, so where do you record V4R? Can you see the options now?
No, we cannot see options.
Hold the timer, please. Hold the
we
timer.
cannot see option.
Hold the timer. Technical team, I think they need to see the options in order for them to answer.
It would be so high, na? Second पे तो हम first रखते हैं ना?
V2
Please
fifth
pin
mid.
Cardio
You have
Super
to
League
pin.
window.
Yes, you have to pin the Cardiac Super League window. Please pin it. You'll have to pin the window. The on-floor team is
The
supposed to.
answers are blurred. Screen is blurred. We cannot see the option.
Okay, so this is some internet issue. You want me mobile? Yeah, they are actually trying to help them with mobile. They'll have the app opened up and maybe they'll facilitate them. You want me to read the options for you?
Yes.
Okay, so can I see the options, please? So to record V4R, where would you place the electrode? Now, option A is 4th intercostal space at left sternal border. Option B is 4th intercostal space at right sternal border. Option C is 5th intercostal space in right midclavicular line. Option D is fifth intercostal space at right sternal border. E is none of the above.
Okay, it's Charlie.
Are you sure it's Charlie?
Yes, yes.
Okay. You want me to lock Charlie, which is fifth intercostal space in right midclavicular line.
Yes.
Okay. So they want me to lock Charlie, C option. Lock it. Oh, yes. Very well done. That's a six, fourth in a row. Even with this technical issue, they were able to answer. It was a difficult one to play, but very well done.
There is technical problem on the screen. Screen is very short and we cannot see properly because the screen is blurred. Options are blurred.
Okay, I think I'm going to hold here because I want the technical team to resolve it. It's an interesting game going on. We may just go to the wire. We can't spoil it like this. Technical team, if you have the mobile, put it on the mobile. If you have some handouts, you can give them the options with handouts as the questions come. It's a wonderful game going on.
Iftikhar, are you with us?
Yes, sir. Dr. Fawad is there.
Yes, sir, I am here. Dr. Fawad, I am here, but unfortunately, I am busy in a case, so I will give my opinion at the end of the procedure.
Okay, so that was Dr. Iftikhar with us. He'll join us back as he's busy in some procedures, so it would be great to have him. And so is the technical issue resolved?
Screen is still short, like the frame is very short. Okay, now the screen is full, but it's blurred.
Okay, I think we'll need a couple of backups for this scenario because we may have these technical internet issues, and I think this has been discussed.
Window of Dr. Iqtadaruddin. Is it the chapter coordinator, Mushaira? Dr. Iqtadar, are you with us?
Dr. Iqtadar, are you there? Can you hear us?
I think he must be busy somewhere. Over to Hamza. Hamza, actually, I am leaving for some issues, so it's goodbye from my side.
Oh.
And I hope you'll continue as usual.
So we'll miss you because this was a great game going on. We needed you for sure, but we'll miss you though.
So we have a mobile phone. We can answer the question through mobile phone.
Okay, so now you have the mobile phone and you'll have access to the options and the scenario. That's good.
You can now show the question, please.
Okay, so can we have the next question on the screen? Question number 5. Read, please.
Which antiplatelet medications will you like to administer to this patient if you have all antiplatelet medication available? Aspirin plus prasugrel, aspirin plus ticagrelol, aspirin plus clopidogrel, aspirin plus canagrelol. No need for upfront any platelets.
And 60 seconds. Start now. Okay, so hold the timer, please. Hold the timer. So S.I.C.V.D is not connected. All right, so there seems to be a technical issue and it's an internet issue, I think, nationwide. And we do apologize for this. But I think this is beyond the hands of the technical team at the moment. They're trying their best to get hold of things. So we are still waiting. I think they are trying to have them connected. Okay, so we do have them back. Let's see if all is well.
Okay, so
Thunders?
we have a screen now.
Okay, you have a screen and you can. Okay, so can we start now?
Yes.
Okay, so I think I would request everyone else to be on mute. Only the answering team to stay unmuted, please. Okay, start the timer. You had 50 seconds now.
So it's alpha, aspirin plus prasugrel.
Are you sure?
Okay. Just give me
You
2
have,
seconds, please.
yes, you have 30, more than 30 seconds.
Okay, it's alpha, aspirin plus prasugrel. If all
Okay, they are now sure. They want us to lock alpha. Option A, lock it. Oh, yes. Straight drive. It's a straight drive for a 6. Beautiful, beautiful answering. And I think you are playing like champions at the moment. Very well done. Very well played. You are still on a hunt. Well done, Thunders. Okay, so it's 5 out of 5. Question number 6 on your screen.
Which of the following trials established superiority of prasugrel over ticagrelol in acute coronary syndrome? Plateau trials, ISRA 5 trials,
Not see the answers.
Okay, hold here, please. They can't see it
54
again.
trials, Twilight trials, and TICO trials.
Okay,
Able to see the answers.
you can see it on your mobile, so we'll start the timer. You have the mobile, right?
Now we can see.
Okay, start the timer. You have both the options available. Is this a googly? Well, well. Twenty seconds. Come on. 15.
That's Bravo. Bravo.
Okay, are you sure?
Yes.
Option B, bravo. We are going to lock it now. Lock option B. Yes, that's very well played. You got it right. I thought it was going to bamboozle you. It was a googly, but you played well. Another 6. That's wonderful. 6. 6 and 6 gives us 36. Very well done. Very well done. Great game so far. And Jinnah, eagles. They are watching like eagles. You can just miss one question and you'll tie. You miss 2, you're gone. You answer all, you win, and it's a record. Great one. Great one. Yes, question number 7 on your screen.
How will you like to manage the patient's hypertensive spike? Oral metoprolol, IV metoprolol, oral metoprolol plus nitrates, IV metoprolol plus nitrates, and enalaprilat.
And your 60 seconds start now. So we would like to hear the answering team discussing things. Keep your mic open, please. It should be unmuted. S.I.C.V.D. Thunders. We can't hear you. 30 seconds. Twenty seconds. S.I.C.V.D. Thunders. We can't hear you. Are they there? Come on, 10 seconds. Hurry up. 9, 7, 6, Come on,
Okay,
answer.
it's epsilon. Epsilon.
Okay, epsilon E, enalaprilat. All right, so you should keep your mics unmuted so that we can hear the discussion. So I thought you were not there. All right, just at the last moment, half a second left, and you've given the answer E. Lock option E. Oh, goodness. Goodness, it was IV metoprolol, the correct answer. And with this, now you've missed your first question and you were playing brilliantly, very well played. Well, you still can tie it. You can still tie it. So be careful. Well played, well played. Question number 8 on your screen now.
Regarding anticoagulation, which regime will you like to choose for this patient before shifting from primary PCI? Heparin 5000 unit in IV stat, heparin 50,000 unit subcut stat, injection heparin 7,000 unit IV stat, injection enoxaparin 1 mg per kg subcut stat, injection enoxaparin 1 mg per kg IV into stat.
Okay, your timer starts now. So it's 5,000 units, not 50, right, in the first two options. Oh, it's getting tighter now. The deliveries are also getting tougher. They are yawking them now. Thunders, we still can't hear you. The discussion is something that we would like to hear. 22 seconds. 15 seconds.
Probably it's Charlie.
52 के करीब वेट होगा ना.
10 seconds.
We should go for the
Come on, hurry up.
जल्दी बताओ.
4, 3, 2.
It's
Oh,
alpha.
goodness. So the time was up. And I would like to take the umpire's call here. We have Professor Abdul Hamid Siddiqui. Sir, your input.
I think they were just in time, so we can give this benefit of doubt to them.
Okay. So just now quickly answer.
Maybe fraction of second in time.
Yes, just microseconds, milliseconds maybe. Answer please. What was the answer? It was C.
They, I think this alpha was the last call.
It was alpha.
Alpha.
Alpha. Okay, alpha. And you want me to lock alpha? We don't have a choice. We have to lock alpha. Lock it, please. Oh, goodness me. Goodness gracious. So, well. So, never mind. You were playing very well. You still can play well. Still 2 more questions to go. And we now have the result for this match. But never mind. I think you can still play for the rest of the tournament, and I'm sure you'll do that. So question number 9 on your screen.
My screen. The screen is not visible to me.
Okay, now we have a problem in Lahore. All right. So
give me a minute. The patient is taken to the cath lab for primary PCI. What is the target ACT that you would like to maintain in this patient using a
hemochrone device?
Hemocrotin device, something not visible, and provided there is no administration of tirofiban during this procedure. Next options are not visible to me. Sorry.
Okay, so option A is 200 to 250 seconds. Option B is 250 to 300 seconds. Option C is 300 to 350 seconds. Option D is 400 to 450 seconds. And option E is none of the above. And the timer starts now. 60 seconds.
It's Bravo.
Oh, that one was quick. It's Bravo. Are you sure? Sure? Should I lock it?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 1 Yes.
Don't lose heart. You've played very well. Okay, you want me to
It's
lock
Bravo.
option B, Bravo. Lock option B, Bravo. Another one missed here. You were very close. Very close. All right. So, with this, we now move to question number 10, the last question of today's match. And here it is.
The the
The patient undergoes
primary PCI to RCA 1 into deaths via right radial artery. However, post procedure, patient develop a painful swelling along the access site measuring 10 centimeter. There is no restriction of finger movements. What is the grade 1, grade 2, grade 3, grade 4, grade 5?
All right, the timer starts now.
Restriction of movement. There is no restriction. 3, 4 content. होती grade 4 है तो restriction there is no restriction movement मतलब finger moves होगा restriction कोई नहीं है तो 2 या 3 में से कर दे exactly ये याद नहीं है B Charlie Charlie 4 में okay क्या Charlie
Okay, so you want me to lock option C? Charlie?
Yes, Charlie.
Okay, they want us to lock option C, Charlie. Lock it. Oh, we missed it. That one was a Yorker, and you had to dig out this one, and you missed it. Never mind, never mind. So, with this, we come to the end. Well, some very difficult Yorkers, I would say, in the end, which became difficult to dig out, and that leaves us with a score of 36 in the end. And we now have the winners, Jinnah Eagles. They have played brilliantly well today by scoring 54. It was a great performance, and they tied the highest ever score in the second season by just missing one question. And it was a brilliant start by S.I.C.V.D Thunders. My commiserations to them, but you really competed well, and you should go back home with a big heart. Very well done, and I think there's a lot more wonderful matches and scores coming from you. And with this, I'll request our umpire for the game today, Professor Abdul Hamid Siddiqui. Sir, your thoughts?
Yes, first of all, congratulations to Jinnah Eagles. They played very well, only missed one question. The pitch was the same, but I think the Thunders, they got 3 odd deliveries in the end. Not that difficult, but anyway, it's part of the game. Anyway, good luck for them for the next time. And I think, once again, congratulations to the Jinnah Eagles. Very well played. Thank you.
Sir, I think the pitch was definitely the same. The difficulty of deliveries was also quite consistent on both the ends, but I think in the end it was a game of nerves and a wonderful performance by Jinnah Eagles. They really did well, but S.I.C.V.D Thunders, they just became short by a little margin, and they should go home with their heads held high. And now I move to Professor Feroz Memon. He's there. Sir, your thoughts? So you'll have to unmute. I think he's there. So we do have Dr. Iqtidar with us. I think Feroz Saab is not there at the moment. Dr. Iqtidar, is he there?
Yes, I'm here. Yes, I'm here.
So it's Dr. Iftikhar. Great to have you, sir.
Thank you very much. I would like to congratulate Jinnah Eagles who played really well. Definitely the questions were well balanced and the scenarios were also balanced. definitely Jinnah Eagles gave us a huge target, and our team did not answer at the end. Initially, they started very well, but could not make up it. But congratulations to both the teams and all the best for the Jinnah Eagles.
So very, very well said. I think it was a brilliant game. Both the teams fought well, and in the end, we can only have one winner. So that's what it is. But congratulations to definitely both the teams. And I think with this, we have come to the end, and our experts. Do we have Professor Feroz there? Because I could see him. Okay. So I think.
Assalamualaikum Hamza, Dr. Bilal here.
Okay, Dr. Bilal.
Can you hear me?
Oh yes, I can hear you.
Well,
Great to have you,
Team Jinnah. Congratulations, Team Jinnah. They have to win this match. This one is the month of Jinnah. Questions were easy on both sides, and the options were not relevant to the questions to the Team Jinnah. Although the question were also the same in the second part with S.I.C.V.D. products. They have lost the questions. They were easy, I think so. But in the end, where you said well, the one team had to win. So congratulations again to them, and best of luck for S.I.C.V.D. Thunders.
Thank you very much, Dr. Bilal. I think very well said. Month of Jinnah, the month of independence. What a month it is. And Jinnah definitely, I think they played well. They both had almost equal difficulty level. The pitch was the same, and we have seen much tougher pitches, much more difficult questions in this season so far. But I think the credit goes to both the teams for competing so well. And hopefully in future we'll have much bigger competitions, tougher competitions, and the teams will shine even brighter, as this competition is all about taking home knowledge. Winning and losing is part of any game as it comes. So do we have any other panel members who would like to say anything or any comments from anyone? Okay, so I think with this we now come to the end, and it was a great game, wonderful match. And do we have Dr. Iftikhar there? Iqtidar, Dr. Iqtidar, do we have Dr. Iqtidar, are you there? No, I think Dr. Iqtidar is not there. So yes, we are coming to the end now, and with this I would like to wind up the session. Very well done, both the teams doing great, but in the end one team wins, and Jinnah Eagles it was, scoring 54, which is the highest of this season, and they've tied it, and very well done. And now it's time for me to sign off. Hopefully I'll see you in the next game, and it's going to be a very tough competition like always. Till then, it's Allah Hafiz from me. Have a great day.